Fantastic. So I'm gonna wash my hands. As I said, I bring the Pelican belt. I got the woolly walkers outside, and after washing my hands, I'm gonna knock on the door and get in. All right. Good morning, Mr. Peter O'Connor. My name is Gabriele Sassi, and I will be your treating physiotherapist for the day. You can call me Gabe. How are you today, sir?
I'm well, thank you.
Fantastic. So, Peter, as you might see, I'm not alone in the room. There are my two other people. Those are my assessors. You don't have to be worried about them. They're gonna observe my assessment. So, are you all right if we are all together in the room during my assessment?
All good.
Okay, thank you very much, Peter. So, just to make sure I'm not making mistakes, could you confirm that you are actually Peter O'Connor?
Yeah, that's my name.
Okay, fantastic, Peter. So, do I see anything in particular? How did he come in? Is he
No.
sitting on the plinth?
I think that this is a chair.
Okay.
Let's pretend.
Okay,
this is
so it's a chair.
Yeah.
Okay, perfect. Is it a wheelchair or a normal chair?
A normal chair.
A normal chair.
Yeah.
Okay, so I'll just have a look. Like, can you see me properly and hear me properly?
Yeah,
So
I don't have problems.
okay, fantastic. So basically, we'll explain what we're gonna do. On today's assessment, it's gonna last about 45 to 50 minutes, in which I will ask you quite a few questions. That's gonna be my subjective assessment, and it's gonna be done to have a better idea of the case of your case. After that, we would go through some goal setting about today's session in 3 months' time.
Mm-hmm.
And then it would get to an objective assessment, which is more like a hands-on assessment, where I will take some measures about you, and then we will go for the treatment. Are you all right, sir, about having it?
All good.
Okay, that's fantastic. Thank you very much. Sorry, how can I call you? Like, is it
Peter is fine.
Peter is fine? Okay, sorry, Peter. So just, it sounds like a silly question, but could you tell me like where we are, what time of the day it is?
Sure. Today is Friday. I think it's the 5th of July.
Okay.
And yeah, we're in the clinic here.
Fantastic.
Clinic.
Okay, are you comfortable the way you're sitting, sir?
Yeah.
Is the temperature alright for you about the room?
It's alright.
Okay, fantastic. I just have a check about around, but it seems everything is safe. So, do you mind if I sit here?
Please.
Thank you very much. Okay, so Peter, I read from your file that you've been having this kind of pathology, multiple sclerosis,
Yes.
for the past 15 years, is that
Yes,
correct?
that's correct.
But recently, like about 6 months ago, you started having a sort of deteriorating of the condition.
Yes.
Okay, would you like to tell me what happened actually?
Well, I started feeling like my hands were not, responding well. So I was struggling with gripping things and manual handling of the stuff.
Okay.
So yeah, because I work as an investment banker. So yeah, I work as an investment banker, and it's hard for me. I started to be really hard for me to just grab the files and stuff
Okay,
like that.
so you actually seek advice from your GP, or you went straight to the hospital?
I went straight to the neurologist,
Okay.
sorry, my GP first,
Yeah.
and then he referred me to the neurologist, and then he advised me to go, to the hospital.
And did it happen before that you had to go to the hospital?
What was that?
Did it happen before that time that you had to go to the hospital for a while?
Yeah, probably a couple of times. I don't remember how many times before I have been at the hospital. So yeah, it's 15 years with the condition.
Okay, so you've been a couple of times.
Yeah, the hospital.
And I see from your file that there has been like a bit of a change in terms of all the symptoms all the feelings, all the stuff that you've been going through. Is it similar to a past condition, would you say?
It's pretty much the same, but it's getting worse and worse each time.
So what's the current problem at the moment?
It's just that I feel extremely fatigued. Things that were usually able to do, I'm not able to do them anymore.
What do you mean about those things? So could you
Feeling like weakness, especially with my hands and my lower extremities. So it's like a general weakness that I'm feeling, and yeah.
I read on the file that you've been working with the occupational therapist and physios.
Yeah.
Are you working on your hands?
Just a little bit.
Just a little
Yeah.
bit. Okay, but you've been doing it quite actively.
Yeah, we are working on that. We just started on that with the occupational
Okay,
special
so
service.
you're on it.
Yep.
Okay, and you talk about fatigue and weakness. So, for instance, Peter, how did you get here?
I had to walk. I use my wheeled walker.
Oh, you got a wheel walker?
Yeah, but
It's
I
not
have
in
to
the
take a
car.
rest every like 10 meters.
Every 10 meters, okay?
Yeah,
Because you get very fatigued after
very
10.
fatigued.
Like if we would put in a measure like in between 0 and 10, doing that 10 meters, how fatiguing it is in your opinion?
Probably will be like a 5.
A 5, okay, so let's
Fine.
suppose that 10 is like having been running a marathon just now,
Yeah,
so 5 would be
like in the middle.
okay.
Yeah, 6 sometimes. It's just the feeling of the weakness,
And
especially with my right.
how do you cope with it? You stop and you sit on your...
Yeah, I have to stop, have a rest, catch my breath back, and then it takes like, I don't know, maybe 5 minutes, and then I have to start again, walk further 10 meters.
Okay, and I see you've been seeing a physiotherapist for quite a while,
Yeah.
and you made some sort of improvements while working, didn't you?
Yeah, some sort of.
Okay.
Wasn't too bad.
Did he give you some exercises to perform back home?
Not really. I don't remember any home exercise program that they gave me.
Okay.
So yeah,
So at the moment at home you are not exercising that much?
not much. I'm just trying to cope, with my daily life things and.
Okay, did you experience any fall lately, any falls?
Not falls, but I feeling really wobbly.
Okay,
Yeah.
and is your house like set up like properly for you? Have you got like the...
Well, I don't know if I'm the right person to answer that question, but I know that the OT came,
Okay,
they did an assessment,
okay.
and that's done.
So the OT has been done.
Yeah.
Okay, fantastic. And are you experiencing any pain at the moment?
Well, it's more of like a soreness, stiffness in the back, and obviously the legs.
And do you have any soreness or stiffness on the legs, back of the legs, calves?
Not soreness, not. How can I tell? It's like more the feeling of a weakness or and fatigue. Is that
Have you got this kind of pain or situation at the moment?
Not really, not at the moment.
You don't have any pain at the
No,
moment?
no.
Okay,
Not
and
really
in terms of the fatigue, are you fatigued at the moment? Are you kind of exhausted even right now?
Well, talking takes a little bit of me, so not fatigue, but yeah, I'm feeling, not like in a rest.
I hear your voice now, it's quite clear, but I read from your files that you had quite a problem
Yeah,
with...
I've been having like problems with choking, especially in the morning. It's
Okay.
when I just waking up, it's.
Have you been working with that with somebody?
I haven't checked so far with any other
So,
professional.
like actually there are speech pathologists and logopedists that they do work with these kind of issues. Like, would it be alright for me if, like after the session I would make a letter and I will report your GPs or a neurologist in copy what we've been doing today, and I could make maybe a sort of a referral for a logopedist just to try to work on this problem. Would it be alright for you?
Yeah, I think so.
Okay.
I mean, I don't know how they can help us.
Oh, well, I'm not sure either since it's not my scope of practice, but I know that it's there. So basically, they will help you on the managing of this situation and probably for the better.
Yep.
I don't know if it does make sense.
Yeah.
Okay.
Let's see how it goes.
Okay, so you would say that your the way you're doing things is quite different from 6 months ago.
Yeah, it is.
Okay.
Yeah, I've been, sitting more and doing less exercise.
Because did you used to do exercise?
Not properly exercise. I mean, I haven't go to the gym. I mean, just staying around in the house and do my work. But now I feel like I'm really fatigued, so I'm not able to.
You're not. This fatigue is really detrimental. Okay. And did you used to be quite active before, generally speaking?
Yeah, not too bad. I mean, I used to go for walks every now and then. I used to take the bus to go, to my workplace.
Okay.
So yeah, it wasn't too bad. But yeah, in these last 6 months, has been like, going
completely
down.
Understandable. Yeah. But in terms of your kind of mobility at the moment, how do you manage to get out from the bed?
Well, I can do it by myself, but It's hard,
It's hard,
but
but you can do
I
it.
still can do it.
You can manage it.
Yeah.
And in terms of sitting, can you stay
I
sitting
can
up
stay sitting by myself.
by yourself? Okay, and standing up.
Yeah, I can stand up by myself. Also, it takes a while, you know. It's
Okay.
like a sort of a quite an effort to standing up.
Okay, and walking around, it's quite demanding.
It's not difficult. It's just a fatigue. Yeah,
And
it's just fatigue.
do you use the device inside the house and outside the house
Yeah, the
always,
whole time.
all the time? And have you got any stairs at all?
No, I don't
No.
have stairs.
And how are you coping? Not even in the outside, or
No, it's a it's flat to get in and out of my house. So
but have you been having the need to cope with any stairs even outside at the moment?
not really.
No, not
Because
really.
even my workplace is flat, so
Okay.
yeah.
How are you moving around? You driving yourself or somebody else is driving?
Somebody's driving me.
Somebody
Yeah,
is driving
my,
you.
my wife is driving me, around
Okay, so you're
when I
married.
need, because I haven't been able to do much
And
stuff.
have you guys are you guys coping all right with this situation at the moment?
Yeah, I mean, she still needs to work. We still have kids at school, so
Okay,
yeah,
so
it's
you got
been. I'm
you
still.
got kids like you got more than one, I suppose.
Yeah, I have two kids. They are 7 and 10. Sorry.
Yeah.
And yeah, they are at school.
Yeah.
So, but you know, it's also.
Are you guys managing all right?
Yeah,
the
we're
situation?
doing so. So far, we're doing well, but I'm expecting to be more present for them. So
Okay.
I want to regain my, my independence and stuff like that.
Sure.
So my wife doesn't need to,
Yeah, completely understandable. Does it happen that when you walk around you feel like a catch on your legs?
No, it's just that it's weak.
It's
That's the only
okay.
thing that I can
But
tell.
nothing happens like like a sudden movement that you can control, something like that.
Nah.
Okay. Okay. And I read from the file that you develop this kind of condition where you actually feel a bit less balanced and you got some kind of, like trembling movement on your left side. Could you confirm that?
Yeah, 100%.
Do you feel it weaker that side
I
at the
think
moment?
it's my right side, especially my right leg is not working properly. I feel like my right leg is, I don't know, it's getting worse than
The
the
right
left
leg.
side.
Okay.
Yeah.
Okay.
And well, also my upper limbs are, really weak. I'm trying to get my, my
Yeah,
files and stuff.
we get to it. In terms of your head, do you ever experience any light in the head, like some kind of dizziness, nausea?
Just when I do more exercise that when my body is able
Okay.
to handle,
And you get dizzy?
A little bit.
A little bit?
A little bit of dizziness, but it's like I don't know if you have done like any time when you do too much exercise that you get like a little bit of
Okay, yeah, because maybe you breathe in even a lot, and you breathe in out a lot of carbon dioxide, and that actually might have this feeling. Okay.
Could be something like that. I really
Okay.
don't know.
Any nausea though?
Nah.
But you're okay. And in terms of talking about the past or recently, have you been having any night sweats? Any kind of, did you lose weight like in a sudden and you can't explain it, or?
No, I have gained a little bit of more weight,
Okay.
because I'm not doing much.
Yeah. Did you have any fractures in the past? Have you got any heart disease I should be aware of?
Not that I'm aware.
Any rheumatoid arthritis?
No.
Have you got any history of asthma, respiratory issues?
No.
Any diabetes?
Neither.
Did you ever have any surgeries?
Not that I'm.
Okay. Osteoporosis?
Not that I'm aware.
History of cancer?
No.
Do-
Not even in my family.
Do you feel your sensitivity has been like a bit affected lately?
Yeah.
On the legs, on the arms, on the feet?
Yeah, especially in my, both arms and my legs, and especially the right one is, something's happening with the right
Okay.
one.
So you told me about your family, like you got your wife, which is she's working,
Yeah.
and your kids, they suppose they go to school, and
Yeah.
you said your guys are kind of coping alright at the moment.
Yeah, so far we're doing well, but I want to, get back and do my stuff.
Okay, yeah, that's completely fair enough.
Yeah.
Um, so you're not back to work at the moment?
No, I'm in a long leave now.
Long leave?
Yeah.
Are you guys alright? Like your company is supporting you?
Yeah, I mean, they don't have much choice, to be honest. I mean,
They
this is my disease and I can't do much about it. They know my condition, so they're aware of what I'm doing, you know.
okay, so you're kind of fine about it.
Yeah, sort of.
Did you experience any memory loss lately? Losses
No.
like are you coping alright with the situation?
What do you mean with
Like
which situation?
what do you think it's gonna be for the next future? Like are you confident that you're gonna be alright?
Really, I don't know. I really don't know. I'm like in a very uncertainty of what's gonna happen. I mean, I hope to get back to my work and get my life back, but
Do you feel you ever need any support about it? About somebody to talk about it? Like it's not Moscow.
well, um, sometimes I feel like feel like under the weather and feeling not in the best mood because
Okay.
it's
I
hard.
don't know if I cannot help about it, but if you want, I could make even a referral for a psychologist, which could work with people with have been going through your disease, and it might be helpful. Maybe.
Well, yeah, that things maybe will be helpful. I
Okay.
don't know.
I'll just write everything down and make the referrals.
Yeah.
So as I said, like I'm trying to get in. I'm gonna write down everything, and in terms of exercise or what we do, I will give you the exercises, and then I will send a copy to your GP and your neurologist, so they can be aware even of the situation, and we try to make the team like close together about the situation. So, in terms of your expectations about today, what do you expect from us?
Hopefully, I would be able to get rid of my walker.
Get
That's
rid.
yeah.
You would like to get rid of your walker, but from the latest report that I got, one the closest one is 2 days ago. I see you you were a bit struggling walking around. You needed two assistants to do
Yeah.
things. So it's probably something that we are not gonna be able to reach today on today's session. So we might start be working on this kind of fatigue and weakness
Yeah.
to improve our balance, and we could actually have it as a long-term goal to see how it goes. Okay, so we might see, okay, maybe in a couple of months' time, see how it goes, or little by little, we keep checking on it. Since I would like to see maybe today and in 2 days' time, so at least twice a week, and we'll see what the improvements are and if the pathology remits and we get better. Okay, because with your pathology, like we know your situation due to this exacerbation, we call it, we needed to make the right move, the right settings, the right exercises, the right activities, so your nervous system can actually reorganize, okay, and regain the function.
Yeah.
Okay, so it's something we cannot really judge at the moment, but little by little, like I see 2 weeks ago you had some results, and 2 days ago these results were different in better,
Yeah.
so you're getting better. Okay,
Yeah.
so we could make a long-term goal. Is that all right for you?
Okay, that's fine for me.
Okay, thank you very much for that. Now, I would like to go like through more of a objective assessment, which is hands-on. Are you all right about it?
Yeah, sure thing.
So, did you have any? Did your eyesight get worse lately?
Yes, they get worse, but since I was at the hospital and they started doing the medication, it did improve a little bit.
It did improve. And now are you wearing glasses usually?
Not wearing glasses. It's just that sometimes I get this double vision.
You get double vision.
Yeah.
Okay. And you get any blurred vision?
Not blurred, but yes, with the double vision sometimes it's getting better since I came out of the hospital. But
okay. So just to start with, I would like just to see like a few things from your eyes. Could you please look at this pen? Okay. Could you follow the pen from one side? Just not moving your head.
All right.
and to the other side. Okay, and we go down and we go up. Assessors, do I see any changes? Do I see any nystagmus? Do I see any problems on
Just light nystagmus to the left, but not
light nystagmus to the
light
left?
nystagmus.
Okay, and now just can you tell me when you are seeing the pens?
No,
Okay, now you see both of them.
both of them.
Alright, and now in terms of your hearing, you said you can hear me properly. I will just do a bit of a test with your hearing. Can you read properly?
Yeah.
What about here?
Same thing.
They do the same?
No problem. Yeah.
Okay. And while looking at these, do you have any diplopia?
Not
Any
doesn't
blurred
say
vision?
not blurry. No.
Okay. Do you get color? Did you get a bit colorblind lately?
No, I haven't seen any blindness of any color, but yeah.
Okay, fantastic. Now, I will just give a try to your sensations. So I will take this napkin, okay, and I'm sorry, I will just put your napkin here. Can you feel it?
Maybe can we speak a little bit louder?
Oh, okay,
so
yes,
they can
yeah, sorry,
catch up?
sorry. Okay,
That's
so I will just put the tissue on your forehead. Can you feel it?
Yeah.
Okay, now we'll go on your legs. Could you please sit a bit better for myself?
Sure.
Okay. Since I will do it even on your legs, am I allowed to?
Yeah.
Okay,
Go
so
on with hand, that's fine.
up.
Let's pretend I'm with shorts. That's
Okay, down. Okay, so now I will ask you to close your eyes. Please do it for me,
fine.
and I will just go over here. I will bring up your arms. Okay. Can you feel it? Are they the same?
It's the same, but feels like not properly, you know.
Both?
Like, both of them.
Okay.
Feels like weird sensation.
Okay, what about this one?
Same thing.
Here?
Same thing.
Okay.
It's like feels like weak, you know.
Okay.
Doesn't seems, you know, like properly feeling.
Here?
Yeah, feels like
Are they
numb.
the same?
Probably a little bit numb, you know.
The same in here?
Yeah.
Okay. Can you just go over this side? Are they the same?
The same. Doesn't change.
Same?
Yeah.
Same here?
Just numbness. General
Okay.
numbness.
I will do a bit of the same here. Okay. Which one am I? Can you close your eyes,
sorry.
please, Peter? Thank you very much. Where am I touching?
Right side?
And what about now?
Left side.
Where am I touching you?
Left side.
Okay. What about here?
Yeah, both sides.
Sides. A lot of difference in between the two.
Yeah, the right side doesn't feel the same. It's
What
really,
about here?
not really impaired. Just the left side.
Here?
Not too sure.
About here?
Yeah, both sides now.
Okay. Sorry, I'll take off your shoes.
Yeah, sure. Okay, so let me get off my shoes.
Yeah. I'll take off your socks too. So
That's
we
alright.
pretend we took off the socks. Sorry about that. And,
That's alright.
how do you feel now?
I feel both ankles, but you know the right is not the same.
Okay.
It's really weak sensation. It's really weak.
Okay.
Yeah, both sides like probably in the middle.
Okay. So then you said you didn't experience any catch.
No catches.
No catches.
No.
Okay. I will just do a quick check over here. Just give me a second. Okay. I will do this movement very slow. And then again.
No, there's
No catch. Okay.
no catch.
I'm trying this feature called spasticity. Okay.
Mhm.
So we see how your muscle responds to my passive movement. No catch. Okay. Nothing accessors on your left, right?
No.
Okay.
No spasticity.
Slowly. Okay, I will do here. Anything in here?
No.
Nothing. Okay, and then I will do the right leg. Nothing.
No catching.
Okay, and I will do here. Okay. Okay.
No.
Alright. So sorry, Peter, could you do, I will leave you barefoot for the moment,
Yeah.
if it's alright with you.
Yeah, sure.
Could you please go up with your hands, both of them? Okay, nice. And could you do this other way around? Okay, thank you. And now could you squeeze your hands? Perfect. Could you do a bit of marching on the spot for me? 1, 2. Okay, can you extend both your legs? 1, 2. Okay, can you go up and down with your toes? Up and down, up and up. Okay. Now, sorry, Peter. Could you keep your arms like that? Okay. Hold it. The position. Try not have me to bring it down. Okay. That sounds more like a 4. Now, could you stay like that, please, for me, Peter? Okay. Fantastic. Don't let me bring it up. Okay. So it's a bit weak. Can you keep it like that, please? Okay, these two are probably 3 plus. And now could you bring up your right hip, bring it up and keep it, can you keep it like that? Hold it. Okay, that's probably a 3 plus. Can you keep it up, go up, hold it. Okay, that's like a 4, so that's better. Can you extend your leg, can you hold it? Okay, that's still a 3 plus. Can you extend, hold it? That's a bit better, that isn't it?
Looks like with better the left one.
Can you hold up your feet? Okay, hold it. Okay, okay. And now, can you just bring them down?
All right.
Keep it down. Don't let me bring it up. Okay, and the same over here. All right. Okay. So definitely your right side is a bit weaker. Okay, so I'm gonna report this thing. Plus, could you do some movements now for me? Now, for instance, with your right arm, could you touch with your finger your nose and then my hand?
My nose?
Your nose and my hand. Okay, again. 2. Okay, 3. And we do it with the left one as well. Do I see any initial intentional tremor, Assessor?
Not intentional tremor,
Okay.
but it's like, you know.
Could you do with going to your nose and again to my hand? Go. 1, and then again nose, here. 2, okay. 3, okay. Can we do on the left side? 1, 2, okay. They look similar in terms of the ataxia, maybe a bit worse on the left side. It looks mild on both sides. Now, could you please do this movement for me, Peter? I would like you to go and touch with your heel the point of your opposite knee. 1, okay, and then we go with the other one. 2, okay, and now could you do this movement for me? Okay, and now again with the left one to the right. Okay, it looks like a moderate dysmetria at the moment to me. Secondly, are you sitting on a chair, we said?
Yeah.
Okay. Could you move a bit forward, not standing, like not using the back of the chair? All right. Would you be able to stay in balance by keeping your hands like that? Okay.
Yeah.
Okay. And stop. Do you feel stable by being here, Peter? Okay. It seems you are stable. Please stay here just a second. I need to take a stopwatch that I just forgot.
Yeah, sure.
Okay, thank you. So I go out and take a stopwatch.
Yep. The stopwatch.
I got the stopwatch. Okay. Okay, sorry, I'm back.
That's all right.
All right. So, Peter, we go back to it. Could you try to keep your balance while having your hands like that? Okay, there is a mild imbalance, but you can still do it. Okay, when you have to dress up, do you do it yourself or do you have your wife helping you
Well, my wife sometimes helps me with the, the socks.
with the
But
socks?
apart from that, I can do it by myself slowly. But I can do
Okay.
it.
So with the, if I would ask you to with the right hand to come and touch in here, would you be able to do it?
Probably, yeah.
And back. And now with the left one. Okay, that's fantastic. All right, now I would like to put again
Yeah.
on your shoes.
Let's
I
put
think-
them in with the shoes.
Okay.
That's it. And the next one.
The next
Fine.
one. Just because
Cool.
since you got this sensibility problem, it's quite important that you wear the appropriate shoes while walking around, all right? And I will put you on this pelican belt. It is just for a safety reason, okay? So in case you might be wobbling a bit too much, I'm gonna be here close to you, able to help you. Now, you don't have your walking device with you?
Yeah, I just put
Okay.
it that side.
Okay. Just stay here for a second.
Alright.
Alright. Here. You know how to use it, right? Always
Yeah.
putting the brakes on when it's in front of you. Now, I would like you to show me the way you stand up.
Okay.
Okay? Alright, and you always use this to do it?
Yeah.
Okay. When you are on an armchair, it's actually, in my opinion, better to use the armchair. We will go through it.
Alright.
Okay. Now, since we are here, I would like to test you in a few more movements. Now, I take the stopwatch that I got here. Now, keeping the feet apart in this way, would you be able to bring your weight from one side to the other?
Yeah. You want me to still hold on this?
At the moment, yes.
Yeah.
One. Okay. You feel the weakness and it's a bit
Yeah, a little
harder.
bit of weight.
Okay. All right. All right. Now I won't do it. We might go through it once we are in the parallel bar to the
Alright.
more. Okay. Now, could you please try to march on the spot for me? Okay. And stop. All right. Now, could I ask you to sit down again? Just the way you do it? All right. Okay, fantastic. Now we're gonna take this chair. I'm gonna bring that chair outside. We're gonna go for a little walk and we're gonna do a test straight away. Okay.
Alright.
All right. Would you mind standing up again, please, for me? All right. And now we have this walk. While you're walking, we'll just look at the way you're walking. Okay. Still, we go outside. Okay, let's pretend we are doing about 7-8 meters to get to the chair. How are you, Peter? Do you feel any fatigue?
Yeah, sort of.
Enough. Like, what's the level at the moment? Is it 5, 6?
Yeah, like a 4 or 5.
Okay. Come and sit in here, please, Peter, if you can. Okay.
I don't know if you can see there.
All right. Now, Peter, I've seen quite a few features of your walking and of your balance. Now, what I would like you to do first, I would like to test you. Okay, we will do the tug test, which is the test that you've been doing a couple of times with other physio. So I put the cone over here. All you gotta do is with your walker, I will time you while you stand up, you walked it there, and you go back and you sit. Are you right about it?
Sure.
Okay, fantastic. Brakes on. Okay, 3, 2, 1, and go. I'm staying beside you, I'm not touching you, but just I'm always on your right side, which is the weak side. Alright, and stop. Okay, now take the time. What was the time of sensor?
15 seconds.
15? Well, it was a 30 2 days ago.
35.
35.
30. Let's say 30.
Okay.
30
All right,
seconds.
Peter, I've assessed you by doing the things the way you're doing. Now I would like to correct some things. First, when you stand up, I would like you to use the arm of the chair, always,
Okay.
all right?
All right.
Then, bring out your feet. Okay, when you stand up, I want you to scoot a bit more on the edge of the chair. All right, I'll bring here with the brakes on, and I want you to lean forward with your hands, with your nose above your toes, knees over your toes, and you stand up. So 1, 2, 3, go. All right, that looks better. Okay.
Feels better.
When you want to sit down, you do a few steps back. When you feel the chair on your calves or on your knee, you bring one hand on one arm and the other, and then you sit. Okay? This is actually much better. Secondly, we're gonna go on the parallel bars because I've seen that there is some patterns that I would like to modify about you. Like you are actually walking by not using the heel toe pattern, it's called. So we're gonna walk on this pattern, okay? To start with, we can do it on the chair. What's your fatigue level? Are you right?
Probably a 3
3?
to 4.
Okay, when you are that fatigued, what you could actually do is doing some deep breaths with your tummies. Okay, try to bring the oxygen down your belly. Okay, it might give you that sort of a dizziness that we've been talking about. Okay, which is normal, and you try to recover. We have to pace your activity, so it's gonna be okay. Fine. I'm bringing in the meanwhile a chair. Just stay sitting here. Bring a chair close to the parallel bars. Now we've seen how we walk. Now I would like you to work on this heel and toe pattern by doing this kind of movement. So it will be like an exercising for this muscle. So let's try to do it. And touch and back. Okay, do it again with this one. So you touch and you raise up your hip and back. And you keep always the toe up. And 1. And 2. And 3. And 4. How does it feel?
Yeah, feels good.
Okay. Now, this kind of exercise is one of those that I'm gonna write you and put in your mail to send you. Okay? If we have the time to wrap up, I will wrap up all the exercises that we've been doing. But if we don't have the time, I already tell you, and I will put it on the mail.
Okay.
Now, I would like us to go on the parallel bars. Okay? We're here, brakes are on. I'm coming on the weaker side. Show me the way I told you to walk. 1, 2, and 3, and come up. Okay, now we get close to the parallel bar. We pretend they are here. Okay, so we 1, 2, 3, 4, 5. We say we spend 10 seconds to get in there. Okay, and I'm getting inside with you, and I'm here in front of you. How do you feel, Peter? Are you fatigued at the moment?
3 to 4, I would say.
3 to 4. Okay, now we're keeping the hands over here, and we're doing that movement that we've been doing just before. Okay, we go to 1, and you try to bring up your toe. Okay? Nice, much better. Keep it up even when you step, so you go up and back. Up and back. One more for each side. Up and back. Up and back. Okay, now this movement is good, but you are not doing the movement that brings up the leg, which call it hip flexion. So we want to do some marching on the spot, but before doing that, I would like you to open up your foot apart a bit more. Okay, and we will just do some moving from one side to the other. One side to the other. One side, keep it up, keep it yourself holding the bars to the other. How does it feel?
Yeah, not too bad.
Okay, now we're gonna do another test. So can you step forward with the right side? Okay, this is gonna be your stance test, and I'm gonna time you with the watch. I want you to take off the hands from the bar, and I'm gonna time you. I'll tell you when I'm ready. Okay? Are you ready to go?
Yeah, let's go.
3, 2, 1, go. Timing. Okay, you can hold on the bar. That was around assessor. How I got 5 seconds. Is that alright? Okay. And we go the other way around. Okay. Left side. Alright, fine. Are you ready? We go at the go, you take off your hands, okay? 3, 2, 1, go. Stop. Okay. We got 3 seconds, which is in line what we've been doing. Alright, now I want you to stay in this position.
Alright.
Okay, and we bring the weight forward and backwards. Forward and back. Are you tired?
Yeah, a little bit.
Would you like to sit down?
Yeah, probably. Yeah.
Okay, you got the chair behind you, just do a step back for me. Fantastic. Now, as I taught you, as soon as you feel the chair, grab it, okay, and you go down. Okay, understand we have to pace a bit the activity. Okay, try to do those deep breathing. We got just 2 more exercises, and then we wrap up the lessons. So for the moment, I want to give you 2 exercises to bring home. One is the one sitting that we just saw, okay? And the other one is going to be hip marching. Could you do a bit of hip marching from sitting? Up and up. Up and up too. Okay, can you do like 5 reps for each side? And we could do it 3 to 4 series a day. Maybe you wanna, like organize them a bit during the day.
Yeah, we can do that.
Would it be possible for you?
Yeah.
Okay, have a rest, have a breather a bit. Do you feel any tightness on your calf?
Not tightness.
No.
Just it is numb and there is some weird sensation.
Some weird sensation?
Yeah.
Do I see it's swollen, assessors?
No, not swollen, no changing color.
That's probably in line with the pathology at the moment.
Yeah.
So hopefully by using it by more like exercise therapy, you will be able to recover a bit more, given those sensations. Would you be able to stand up again?
Yeah.
Okay. Let's go whenever you can, like the way I taught you, standing up. 1, 2. Very nice. Remember, lean forward, and 1, 2, 3, and go. Fantastic. Hands over the bar. Nice. And now I would like to step further with your right leg. Nice. Okay. And now we bring the weight to the right and back. And I want you to feel the weight going to the right. Keep touching, okay, the bars and back. Bars and back. Bars and back. Okay, step back and we go again forward with the left one. Step ahead and then forward and back. Forward and back. How do you feel at the moment? Is it tiring?
Yeah.
Okay, stop. Do you feel like sitting down or you're...
No, maybe we can do one more.
One more? Okay, what I'm asking you to... We've been doing this hip marching before. I will try to time you again on that kind of a stance. So could you bring first forward, further your left one? Okay. At the go, as I said before, you take off your hands and I'm gonna time you. Okay? 3, 2, 1, and go. Okay, stop. I got 5 seconds, is that alright? Okay. And can you go back and again with the right one? Okay, at the go, same thing. 3, 2, 1, go. Stop. Okay, it's just a 6 second. Do you feel any tired? Okay, Peter,
5 to 6.
Yeah, let's have a sit. Remember, as I said before, fantastic. All right, we improved just a couple of seconds, but that's actually the track. As I said, the 2 exercises, now we need to get stronger on your quadriceps muscles and a bit on the tibialis, so it helps us even to have a bit more control of over your ankle. Today we have been going through quite a lot of assessments, so the next session will be more exercise and we will be able to pace it a little bit more.
Mhm.
Okay, I didn't do all the comparative tests that have been done by the other physios. Probably we will do it on the other session.
Mhm.
I would like to try to have another walk as we've done before.
Mhm.
So we would move to the other chair to do the 3 minute walking test, the time test,
Oh.
the one way. Okay.
Yep.
Are you right?
Yep.
Okay.
Let's go for it.
And when you're ready, let's
go.
stand up. Up. Okay.
Go.
Remember, take off the brakes.
Yeah.
And we go.
Let's go
And
to the
then
chair.
Yeah. And always stay on your right side.
You still have 5 minutes.
Yeah, it's all right. And can you sit down, please, Camilo? Remember? Oh, okay, that's fantastic. Now, Camille, Peter, I'm sorry.
That's all right.
I'm sorry.
That's all right.
I want you to have a proper recovery. We got the 3 meters. Once you're gonna be walking, I would like first to stand up the way I taught you.
Yep.
Okay. And then when you're walking, try to focus a bit more on this movement, the one that brings up your hip, out your toes and down. Okay. Let's try to bring on this little walk what we just done on the parallel bars.
Sounds good.
Is that alright for you?
Yeah, sure.
Okay. Whenever you're ready at the go, you can start. Brakes,
Let me get.
brakes are on.
Yeah.
3, 2, 1, and go. I'm gonna stay beside you. Fantastic. Remember the hands, stop. Okay, it's alright, it was pretty fatiguing.
Yeah.
Sorry, I suppose I got
28 seconds. 28 seconds.
28 seconds. Okay, we slightly improved, Peter, which is good. Now, as I said before, I'm gonna make you the exercises that I would like us to do. Alright, so possibly if we reinforce enough your quadriceps, a bit of those muscles, and we keep doing some balance training, we're gonna improve it. Okay, we're gonna improve your walking, and day by day we might have some little improvements that added up can make a difference at the end of the sessions. I would like to see you possibly twice a week, at least. And is there any questions that you've got for me?
Not really. No, not really.
Okay, so
Not much questions. Yeah.
to wrap up what we've been doing, I'm gonna make those referrals that we talked about, which is the logopedist for this choking problem, and the psychologist that might be assisting you with coping up with this situation. Plus, I give you the exercises, and I'm gonna get in touch with your GP and your neurologist.
Cool.
Is that all right for you?
Okay, sounds great, Kyle.
Okay. Thank you very much for being my patient today.
Good. Thanks,
Thank
Kyle.
you. Thank you, man.